If you want to deal with your neck and trap, stiffness, and pain once and for all, well, you've come to the right spot because in today's video, we're going to be talking about some of the best things that you can do to get rid of that pain forever. Hi, my name is Dr. Seidel. I hold a doctorate in physical therapy, and I've worked with all sorts of patients from a variety of orthopedic conditions, ranging from professional NFL and BA and D1 athletes all the way to those trying to get rid of that nagging knee pain when they walk or when they go upstairs. What I want to do in this video is give you guys some of the best stretches and exercises to help get rid of that neck and back pain that I give to all of my patients who come in dealing with the same thing. We'll first talk about some of the structures that we'll be targeting and that are the most typically affected, and then I'll give you some of the tools or the exercises and stretches to help deal with it again from the comfort of your own home. If you like this type of content and you want a one-stop shop for helpful advice and tips for topics ranging from joint stiffness, joint pain, mobility, all the way to improving and optimizing athletic performance, make sure to like this video, subscribe to this channel, and ring that notification bell so you get notified whenever a new video comes out. I'll leave timestamps down in the video description so that if you guys want to skip ahead and get the exercises and dip, you can do that and I won't hold it against you. However, I do think that it's important that you guys understand what's being affected and why it's being affected in order to have better long-term prevention of this neck, back, pain, and stiffness. So without further ado, let's get started. So if we pull up a picture of the cervical spine, you can see that there is what we call a reversal of the curve when going from the thoracic spine to the cervical spine and from the middle cervical spine to the upper cervical spine. These reversals often make these parts of the spine vulnerable to excessive bending or shearing forces if not properly managed. So when I'm talking to my neck patients and I'm asking them questions about what they do in their day, how they sit, how they walk, one common thing that I get across the board with all of them is this thing called a forward head posture. Now, poor posture is thrown around all the time and we get used to hearing that we have bad posture, but we don't really think about it until it starts giving us some pain. Mechanically, a forward head posture does a few things. Because you're hunched forward and your head is down, you're required to look up to be able to see normally at eye level with a desktop, a monitor, or even a TV. This posture also results in a forward translation of the lower cervical spine on the thoracic spine, thus the hump we typically see in the upper back. Letting a forward head posture go unrestrained for long periods of time can result in what we call spinal kyphosis or a hunchback posture. When looking at which muscles can be tightened up and cause some symptoms when you're in this forward head posture, we need to look at what area of the spine is the most shortened. And that would be right at the top of the cervical spine where it meets up with the skull. Now, the muscles that would naturally be shortened and tight and could cause some of these symptoms would attach to the base of the skull and to the cervical segments right underneath the base of the skull. And those are the upper traps, the levator scapulae, sternocleidomastoids or SCMs, and a group of 6 small muscles called the suboccipitals. One note on the suboccipitals that I do want to mention, any one of the 6 muscles can be individually a cause for neck pain or even headaches. And while in this video I am going to give you guys a comprehensive stretch to be able to target all of them, further diagnostic testing and some further stretches would be needed in order to pinpoint exactly which muscle is giving you the issues. I'm going to touch on that in a later video, but for the purposes of keeping this video relatively short, I'm just going to give you guys the comprehensive stretch that should be good enough to get you guys well on your way. And if not, you guys can watch my other video to help pinpoint exactly which muscle it could be. Lastly, we need to address the muscles that would be lengthened and weak. That would be the longus capitis and the longus colli, aka the deep neck flexors. A proper rehab and strengthening program should be addressing all of the muscles and the issues talked about in this video in order for it to be an effective program. Okay, so you made it to the exercise portion of the video. If you've learned something new so far and you've liked this type of content, again, please make sure to like this video, subscribe to the channel, say hi in the comments, as this is the absolute best way to prompt YouTube to share my videos to more individuals who are dealing with neck pain and stiffness. Now let's get to these exercises. The first stretch we'll be doing is for the upper trapezius muscle. This can be done by bending the head straight to the side opposite the muscle you want to stretch. making sure to avoid any rotation of the head. If you want to apply an even greater stretch, gently place your hand on your head and provide a gentle stretch into a side bending motion. You will want to hold this stretch and all of the other stretches on this list for that matter for about 30 seconds to a minute. Afterwards, take a small break before repeating the stretch. This can be repeated for 1 to 4 sets. Next up, we have the stretch for the levator scapulae or levator scap. You want to start the stretch by rotating towards the side of the affected muscle or the side of the neck that you have pain on, side bending away and bringing the head down. So for example, if I wanted to stretch my left levator scap, I would turn my head to the left, side bend to the right, and then bring my head down for a full stretch. Again, this stretch can be held from anywhere from 30 seconds to a minute and from 1 to 4 sets. Next, we have the sternocleidomastoids or SCMs. These are similar to the levator scap, but we don't bring the head down. In this example, I'm stretching my right SCM, so I'm turning my head to the right, side bending my head to the left. Hold this for 30 seconds to 1 minute for 1 to 4 sets. Next, we have that suboccipital group that we were talking about. This group of muscles do capital extension or extension of the head, as well as contralateral rotation of the head. Therefore, the most effective stretch should be one that targets capital flexion and rotation. Chin nods and snags are perfect stretches for this and can be done in either a sustained hold or in reps. Both will be shown on the screen. Starting off with chin nods. You want to keep your teeth together on this one so that all of the nodding motion comes from your neck and not from your jaw opening up. Imagine your head is like a foosball player on a rod, and it can only rotate, not move back and forth or side to side. You should feel this right at the base of the skull. And sometimes your hearing might be a little dampened, but that's completely normal and not a cause of concern. Moving on to cervical snags. Grab a towel, belt, or anything similar and lay it around your neck. The video on the screen is an example of a stretch for right rotation, which would stretch my left suboccipitals. You're going to cross your arms, making sure that your right arm is on the top of your left. Initiate the rotation with just your own neck. And once you are unable to go any further, bring the towel across your upper jaw and apply slight overpressure. Make sure to avoid putting pressure on the lower part of your jaw, as this can increase the risk for jaw dislocation. If done right, this snag to the right should feel like you're having a stretch on the left on the base of your skull. Now for the strengthening exercises. Remember, if all you do is stretch, you're just doing poor symptom management. You have to address the root cause, which is poor posture and weak musculature. The first one we'll be doing is called supine or laying down chin nods. It's super similar to the one that we just did sitting up as a stretch for the suboccipitals, but this one we'll be doing laying down. On your back, you'll begin this motion by slightly picking up your head from the floor. Once here, you will then perform chin nods that can be held or can be done in repetitions. Be careful not to jut your chin upwards, as this is emphasizing capital or head extension, which is not what we want. A progression to this exercise is the addition of long neck flexion to the chin nods. This will help further strengthen the flexors of the neck, which are typically long and weak. Lastly, we have what we call cervical chin retractions. You begin this movement by performing a chin tuck, then pulling your chin as far backwards as you can, like you're trying to make the ugliest double chin you've ever done. Again, we want to avoid allowing any capital extension or head extension, as this further exacerbates the problem we are trying to fix. As in the others, these can be done in either sustained holds or in repetitions. Again, if you perform all these exercises and all these stretches, but you still sit in your computer every day like the Hunchback of Notre Dame, you're still going to have pain and stiffness. Part of getting rid of this neck and back pain is, yes, performing the exercises, but also changing your postural habits throughout the day so that you don't have any regression of the stretching and lengthening and strengthening of the muscles that you'll be doing when performing these exercises. So there you have it, a full guide on the best stretches and foundational exercises that you guys can implement today to help get rid of that neck pain and stiffness once and for all. If you guys liked this video and you found it helpful and you learned something, drop a like, subscribe to this channel, and we'll see you guys in the next video. If you want to deal with your neck and trap stiffness and pain, if you want to deal with your neck and trap stiffness and pain once and for all, well, you've come to the right video because in today's, if you want to deal with your neck and, if you want to deal with your neck and trap stiffness and pain once and for all, well, you've come to,